Hello and welcome. My name is Ayush Garath, and I'm the founder of Ashwas, a social initiative to aid frontline health workers, and a member of Inflame Medical Magazine, a student-led medical magazine. On behalf of Inflame Medical Magazine, today I'm going to be interviewing Dr. Ranganath, a senior doctor in the Department of Pulmonology, leading the COVID effort in Narayana Hrudayalaya, Bangalore. So thank you for sharing your time to be a part of this interview.
Thank you, Ayush. Thank you for this opportunity, and good evening, all.
Great. So, sir, could you just to start off, could you describe just briefly your experience during the past year as you and your team dealt with the effects of the COVID-19 pandemic?
Yeah, I think it's an interesting journey, Ayush. So when we started, I think exactly a year back we started the thing. In fact, the late 2019 December, the first case in China was kind of identified. Later, slowly it spread across the world and started by January 2020 and February, we started knowing about the virus, and it spread in Europe and other countries, US. So we started having cases somewhere in March.
Mm-hmm.
And the gravity of the COVID and its infectiousness is kind of started, the information from across the world started coming in. So we realized that that's going to be a big threat. So we had a meeting in the hospital about how to face that. And unfortunately, I think doctors across the world didn't know much about COVID and how to control and those kind of things. Thanks to a few things which happened in Italy, US, and China, we realized that the best way of handling the COVID is to have isolate those patients and identify the cases, isolate them so that they doesn't come in contact with the general population, and more importantly, the patient population who are admitted for non-COVID issues with the sick diagnosis.
Mm-hmm.
So what we did was we kind of identified one 4-story building in our campus, completely converted that to a COVID care center. And it is an effort of basically 3 to 4 departments. Our department, medicine and pulmonology, infectious diseases department, microbiology, and the ICU and emergency department. So what we did was, all of us, around 3 to 4 people from one person from each department, we actually decided to stay in the hospital.
Okay.
And so we really don't know. We didn't want to take the virus home. So we decided to stay in the hospital and started the fever clinic, where we started screening every single person who is entering into a health city there, and find out whether they're potential COVID cases or not, screen them. When we started, we were actually not testing the COVID. RT-PCR was not there with us. We had to identify clinically, refer them to a government center where the test was done. If the patient was sick, we isolated them in a place where in our hospital, sent the throat swab to the government hospital. We were waiting for the report to come. So, and we started writing the SOPs, how to take care of the sick patients, how is the flow of the patient, and how do we isolate. In the meantime, how to take care of the non-COVID patients who are sicker, and if you don't give the medical care, they may usually lose their life. So that was a bigger challenge. So we stayed, I stayed in the hospital for approximately 45 days, 1.5 months in the hospital. So morning you see the patients, evening sit together with the colleagues, write the COPs. We did a lot of civil changes in the hospital. So they created the barricades kind of in the room to facilitate the patient movement and separate movements from COVID and non-COVID. So it was an enormous effort. So it was we were there in the hospital doing it. and we also needed support. We need, so few junior consultants and the resident decided to stay with us.
Okay.
The one thing is, the biggest problem was that there was no lack of information. We really
Yeah.
don't know what we are facing or what we are going to face, and we are also not sure when are we going to have that surge of cases. So people were isolated in a, say, a four-story building, and since we are there looking after that fewer cases, general population were not mingling with us. It was a big challenge for keeping our motivation up during that period. What we did was we kind of started a fitness club.
Okay.
So, so what we used to do is morning, kind of start an exercise routine in group and started running there. So I am a part of a running club where I usually weekly 3 days run. So I replicated that system of running, and then I actually called the residents who were there with me. So morning we used to run, do the exercises, and kind of try to cook in our place where we were staying. So kind of made it an experience like a picnic where we all staying there for some time. Uh, and there was a lot of anxiety. What we did was we roped in our psychiatrists to conduct a Zoom sessions for all the volunteers who were there and alleviate their anxieties. So together, actually, we were trying to motivate each other and keep our spirits up. So yeah, that was the initial few months.
Hmm.
So somewhere in May, June, July, we started having the cases. It's an exodus. Lot of cases came. So that is the period where we were scrambling for bed. Biggest problem during that pandemic is arranging the bed.
Hmm.
So all our hospitals were kind of overwhelmed. Though we are prepared for pandemic, and we are stocked our PPE and medications, made provisions for COVID beds, everything. But when the patients started coming, we fell short of all of these things. It's
Okay.
a kind of all of these things, and luckily, though we kind of started as a department of medicine and pulmonology will handle this thing, and every single consultant, every single doctor from across the department, across the specialty, volunteered to the this taking care of the patients. We kind of from our department, we wrote the protocols of management, how to handle mild COVID, how to do moderate COVID and severe COVID, and kind of used to orient the other consultant, the resident from the other departments in a Zoom meetings before they go to the COVID care centers, and remotely keep talking to them, keep motivating them, and kind of we handle the situation fairly well. So if you look at the end of when we kind of the first wave was over, when we looked at our results, they were not too bad. So roughly we had around 5,000 admissions in that during, which is huge number. So around 1,500 ICU admissions. So remaining around 2,000 in the ward who required oxygen, not the ICU beds. So huge number with fairly
Mm.
good results. Go this thing. It's really a satisfying experience at the end of everything.
That's great to hear, especially given all the scale at which this the
Yeah,
hospital has been working.
for me, see, basically, what if you look at the pandemic of this scale,
Hmm.
happened probably 100 years ago,
Yeah.
and I don't think anybody who was in the in the ground zero handling the pandemic would have seen this scale of kind of, I would say, a pandemic before. It is unprecedented for all of
Hmm.
us. It is something new. So yeah, there are times we are all felt overwhelmed, depressed, and it is like started motivating each other, and kind of we gave them adequate rest in between, took care of the nutrition, make sure that they have good food. So and visibly someone is stressed, give them off, get a psychiatrist to see them. Yeah, it was a good effort overall.
That's fantastic. You mentioned about you spoke about the kind of stress and the anxiety that the effects of the pandemic brought on. Also, you and your team went through this entire journey, how did your family cope with this new change?
I mean, I think I should be ever grateful to the family members. When first 45 days, I was not even coming home,
Mm-hmm.
and they were not allowed to go down. They are actually kind of in a house arrest. They are not. They are not able to go out. They are at home, and our kids are not going to school. No, they are not meeting friends, and you know how difficult for kids. I mean, keep the kids occupied.
Yeah.
So, so the tempers were high, and they were also kind of depressed, and they were all worried about us,
Mm-hmm.
about we contracting the infections and that thing. So we managed through phones, video calls, and those kind of a thing. But I'll be ever grateful for the family members for the support, and they also had the obligation of not showing their frustration to us. They kind of try to be cheerful all the time and encourage us. But I know how difficult for them it was. I mean, I'm sure people can identify their trouble of not going outside, staying at home, and it is difficult. And with the worry of we are being in the center and at the risk of contracting infection, it was added stress. Yeah, it was tough phase, and we are ever thankful to them.
Yeah, absolutely. I think they also deserve a lot of gratitude and respect for everything that they've also been through,
Yes.
along with all the work and effort that you and all the health workers have been doing.
Yeah, because see, what happens is when we were in the center, the
Mhm.
time passes. We never used to think about that. So we were all busy all the time. So there is not much of a time to think. Only in the evenings when you come back from work, that's the time we actually start thinking about the thing, getting depressed, getting frustrated, all those things. And otherwise, we are all completely immersed in the patient care and the activities buzzing around that. So
Yeah.
it's not the, I mean, we are not distracted. But for them, it is COVID from morning till the end, and about thinking our welfare of us, and staying at home, getting bored, and this thing. Yeah, I think their share of frustration is much higher than what we faced.
Hmm. Yeah. Also, coming back to a point that you briefly mentioned earlier, you spoke about how the your hospital pitched in terms of segregating in terms of segregating the hospital into non-COVID and COVID, and providing the new block. How else did the management pitch in terms of helping you?
I am actually so particularly. I can't really speak for all the management. Our hospital, I think they've been exemplary. They kind of supported with everything what is needed, everything what we asked for, uh, uh, starting from what is required for the patient care and running the hospital to the personal needs of each individual who are working as a COVID worker there. So took care of everybody, took care of our accommodation there, took care of our food and those kind of things. Even our personal needs were met. And whoever in the process who got infected, everybody was taken care, and the at the hospital cost. Nobody was asked to pay. So, and roughly, ours is a big organization. We have had around 200 positives of healthcare workers. 200 cases we positive, and I think all of them have come out, and hospital took care of all of them. So made sure they are well taken care. Medications are available, so hospitalization cost is taken care. So it is like it is everybody's healthcare was taken care. I mean, health was taken care. So I don't think I can't ask more from management. They have been exemplary in this situation.
Kudos for them for being so selfless and paying for everyone's healthcare needs. I think that's something that's so like inspiring and must be so motivating for you to continue.
Yeah, it was
Yeah.
it was support was round the corner. Round the corner, it is always there, and we never had to take an answer no for anything. So they were there all the time.
Yeah. So coming to your line of work, I think pre-COVID, pulmonology was never not really a line of in medicine, but that gain much attention. Usually, cardiology or neurology often gain the center stage. But after this pandemic, and um, do you think pulmonology will now really emerge as a super specialty?
See, actually, pulmonology is actually a very, I would say, infant in the field of medicine. So when I came to Bangalore after my graduation, I was around. I think I'm sixth pulmonologist in the city.
Wow.
So and we and we have around 200 to 300 pulmonologists this thing, and definitely COVID has kind of made our presence felt.
Mhm.
So see, now I don't really have to explain what is pulmonology. I only have to say the doctor who takes care of COVID.
I don't think there could be a better
So,
description of that.
it's a now actually the kind of we are called COVID experts, and the COVID experts pulmonologist has become a synonym. Kind of, yeah, definitely it has given us a recognition. I would say so our
Mhm.
pulmonology in terms of recognition got its boost. Yeah, I agree.
Fantastic. I think it's very well deserved too. And
Yeah, but I'll not to take away the credit from the other specialty. As I told you, uh, we are pulmonologists. We kind of when it all started, the onus on us to take care. So as a first line defense, we had to go because we are pulmonologists. We are supposed to take care of the pneumonia, which is COVID pneumonia. But when the situation came, I think we were a handful. I don't
mhm.
think we could handle the proportion of this pandemic. And as I told you earlier, also the doctors from all the department and across the specialty, across the hospital, pitched in, followed the protocol and helped us take care of the patients. So I think, in a way, I think everyone was a COVID doctor during that 6 months period.
Mhm.
So that was every doctor has pitched in, and every doctor has worked towards mitigating the worst.
Fantastic. And finally, given how things were before COVID and after COVID, what do you think are some of the lessons that both the medical community and the general public can really take and absorb for the future? Touch wood, another pandemic doesn't happen, but um, if, say, something does happen, what do you think are some of the lessons that we can take carry forward?
Yeah, actually, what I mean, this pandemic actually kind of gave a picture of how underprepared as a healthcare system to face these kind of a calamities, and which kind of showed the lacunae on our healthcare system, and the lack of screening systems, and lack of healthcare people, and how to respect the healthcare people. And I mean, there is a lot of lacunae, and I think the authorities had taken the healthcare for granted. I think this pandemic brought all of them to their knees and showed their the lacunae, and kind of. I also appreciate our government, which I mean this one, what do you call, the infrastructure was scaled up in such a record time to handle these things. Compared to, I mean, if you look at all the other countries, we have done fairly okay, thanks to our scaling up of our infrastructure, scaling up of our facilities, which was done. Thing. So if you look at the pre-COVID, I think there was healthcare system was quite bad, which
Mhm.
was kind of was. I mean, it kind of came into open, and I think we reacted fairly quickly, and things were scaled up. At the end, I think we handled the whole pandemic fairly well, and the fight is not over. I think what we're looking at the second wave. We will wait and see how things go. But probably, if you look at the second wave, we are fairly well placed, or at least the anxiety is less, preparedness is there. Probably we can handle this more efficiently than the first one.
Absolutely. I think with the second wave, we'll be able to handle much better. We all have the experience and the guidance. to overcome this challenge now. So definitely looking to.
Yeah.
And
And as a population at large, I think population at large, they have understood their responsibilities. And yeah, so the human relations, they understood how precious the human relations. So how important to meet people and greet people, which is also again was taken for granted. And when we realized that, like, during the pandemic, meeting people in person is a luxury. It
mhm.
became a luxury when to meet people and greet people. So people at large, including all our families, understood the value of a human relation, and taking care of our health, the importance of taking care of it. There are a lot of lessons learned as at a population and healthcare system. A lot of lessons were learned in this.
Okay, and hopefully we take those lessons forward and keep improving. And yeah, I think with that we'll wrap up for today. So thank you so much for your time and your very wonderful insights. It was a pleasure speaking to you, and I wish you all the very best. Stay safe.
Thank you, actually, Ayush. You are actually doing some fantastic work, and actually, I can't really forget the sessions you conducted for us, and actually, which kind of I'm sure our participation was good. And at the end of the participation, and after that, we still talk in our department the way you engaged us, and your program, what you conducted, and how what is the relief. I mean, it gave a lot of relief during that stressful period. It was fantastic, and you are keep up the good work, and you have done some fantastic work.
Thank you so much for those kind words. Really appreciate it. And again, wish you all the very best. And please stay safe and keep doing the amazing work that you've been doing. We're very great. We owe a lot of gratitude to all of you.
Thank you,
And
Ayush. Thank you.
to all
Yeah,
our
please go ahead.
viewers, yeah, okay. And to all our viewers, hope you enjoyed this interview. Stay tuned for more such inspiring interviews, and we'll see you all next time.